be aware this webinar is being recorded. I'm delighted to be with you this afternoon. My name is Nessa Barry. I work with the Scirocco Exchange project team, but my day job is as part of the Scottish Government's Technology Enabled Care Digital Healthcare Innovation team. And this afternoon's webinar is part of the Scirocco Exchange project, and the focus for this webinar is about delivering integrated care in remote and rural areas. And I'm really pleased to say we have some excellent experienced people with us who can share their experience of using the Scirocco tool and the experience really overall of how integrated care is being delivered and what the Scirocco Exchange tool offers to that process in more remote and rural areas. And the experience we have today will come from Slovenia and also from the Basque Country. And the first presenter that we have that we're going to hear from this afternoon is Andrea Pavlikova, who is also one of my colleagues. And Andrea is going to explain a little bit about overall service and project and what Scirocco Exchange actually means. And Andrea will be followed then by John Taramendieta. Apologies, John, if I've got that wrong, quite likely, from the
Perfect.
And Andrea then will follow John, and I'm definitely going to get this wrong, Andrea Rafelich, that's probably wrong. Yeah, you can correct me when you come in. So each of our speakers will be sharing their slides, so I hope you will bear with us just in case we have any minor technical issues at all as we go through the presentation. So first I am going to hand over to Andrea Pavlikova, who is going to give us a quick introduction and overview. I've put some messages in the chat if you can take a look at that. Anyone who's joining us, I would ask you to please mute your microphone. And if you want to add any comments or questions to the chat box on your screen, we will pick them up when the presenters have finished speaking. And Andrea, over to you.
Thank you very much, Nessa. So in my presentation, I'm going to give you a kind of like brief overview of the process we have implemented to conduct the assessment to understand better the organizational maturity and readiness for integrated care, which we simply call maturity assessment process. And then, as Nessa said, you will hear a more concrete example from my colleagues how this process was implemented in real life settings. So we conduct this process as part of the EU-funded project called Scirocco Exchange, which focuses on the capacity building support for integrated care. We are the consortium of 14 partners, and as you can see, the majority of the partners are health and social care authorities across Europe. And today, particularly, we will be looking at the examples from two of them, from the Basque Country and from Slovenia. So, as I mentioned, the focus of our project or the activities is the practical support for health and social care authorities to accelerate the adoption and the adoption of integrated care. And we do so by developing what we call Scirocco Exchange Knowledge Management Hub, which we see as the key facilitator of this capacity building support. We see this hub as some sort of like online matchmaking platform, which help us to connect the needs and the requirements of the local health and social care authorities with the existing evidence, experience, and knowledge on integrated care to make sure that we don't reinvent the wheel, but really use and maximize the existing evidence and assets on integrated care. The underlying principle of all of this capacity building support is that it needs to be tailored to the local needs, to the local context. So we are really trying to personalize the activities we do. But the first step for this personalization is really the understanding of local conditions which enables integrated care. So what are the success factors, what works well, but on the other hand, what are still key obstacles or key barriers which needs to be addressed in order to accelerate the integration of care delivery. So that's why the first functionality or the first starting point of using this hub is this maturity assessment for integrated care, which is the focus of today's webinar. The main tool or the main facilitator of this maturity assessment process is this Scirocco tool for integrated care. This is an online self-assessment tool, and I would really like to emphasize from the beginning that is self-assessment tool. So it's not the objective evaluation to say that something works well or not, but really the objective of the tool is to keep people, to capture people's perceptions, how they see and how they understand the delivery of integrated care in their organizations or within their teams or wider healthcare systems. And you can see that the tool consists of 12 dimensions, where we have a mixture of quite strategic dimensions like, governance, readiness to change, funding, but also operational dimensions such as digital infrastructure, capacity building, population approach, and so on. I would also like to mention that due to quite high interest of local health and social care authorities in using the tool, we have also translated the tool into 9 additional languages. Once you register to use the tool on the link provided above, you can actually access this tool in your in the variety of languages. And it's not only the translation, but it's also the whole adaptation of the tool to local context to make sure that we capture the local understanding of integrated care. Also, I would like to mention that this version of the tool is also available for 2 new areas of work. So as I said, due to quite high uptake of the tool, we have also been delighted to expand the use of the tool to 2 additional areas of work, which is one of them is digital neighborhood, and the other one is innovation and open-driven and deployment of open-driven innovation. That's just kind of to emphasize that in case your interest is broader than integrated care, you are again on the same link. You can access also these expanded versions of the tool. Regardless of which version of the tool you will use, you will basically see that really the main objective of this tool is to capture the maturity level of either your organization or the team, or as I said, healthcare system in general. So once you enter the tool, each of the dimension, like for instance, in this case, we have the dimension of readiness to change, is explained in terms of its objectives. So what we are trying to achieve in this dimension. And then more importantly, there is this assessment scale ranging from 0 to 5, where you can see the different level of maturity one can achieve along each of these dimensions. And once you do this assessment across all of the 12 dimensions, you will end up with this graphical visualization of these outcomes, this spider diagram. And as you can see, really, this visualization provides you quite a quick detection of where you are, what's your maturity level. So you see which areas you are scoring quite high. Like for instance, we have here the case of digital infrastructure or breadth of ambition scoring between 4 and 5. But in contrast, you see also very quickly what are the areas where we are actually scoring quite low, like for instance, removal of inhibitors. So the tool helps you to orientate where the focus of your future areas or future actions should actually be to improve the delivery of integrated care in your organization or systems. And we are using this information for, I would say, 2 main purposes, or in 2 ways. First of all, I would say that really this process and the use of the tool is very participatory. So as I mentioned in the beginning, we are keen to gather people's perceptions on how the care is delivered. So we make sure that once we run this assessment, we have the right stakeholders involved, and we hear from each stakeholder identify. And this involvement actually helps you to gather quite interesting insights, because the tool allows you to capture insights of a particular stakeholder group, so you can do different comparisons or reflections on a particular team. Like for instance, if you're interested to know what your social care team think, or just IT guys or decision makers, you can basically split and the different answers, but also compare and contrast. So for instance, here I picked up the example of one of the assessment conducted in Puglia Health and Social Care Authorities, where you see on the left side quite positive assessment from the general director on the level of innovation management compared to the perception of the IT specialist. So you can, as I said, compare different groups, but you can also then also just look at the one particular stakeholder group. And the tool also allows you to do these comparisons between more than 2 stakeholders. So for instance, on the spider diagram on the bottom, you see 4 different perceptions coming together. And again, you see that this functionality of overlaying the different diagrams gives you quite a good understanding where your stakeholders tend to agree, where they are on the same page. Like here we have, for instance, the example of process coordination, where all stakeholders agree this, the maturity level of 2. But then if you look on the other side, on the breadth of ambition, we see very diverse perceptions of these stakeholders. And you can use these individual insights to actually bring all these stakeholders together and facilitate the dialogue and get the understanding why they're actually scoring so different. So what is, I think, important to mention is that we are not looking just to capture this quantitative measurement. So, it's not important if you are scoring 2 or 3, but stakeholders are also asked in this assessment process to provide justifications why they think the maturity scoring is 2 or 3. And that's where you get a really rich data and richness of information, how different stakeholders are seeing the situation. So if you bring all that knowledge together, all of those stakeholders together, you're actually having some really interesting multi-stakeholders discussions. And the key point here is that regardless of their individual viewpoints, the purpose or the main outcome of this process is that they will all have to agree at the end what is the final level of the maturity. So as you can see on the spider diagram, on the right side, on the down part of the slide, you see basically that black line, which illustrates the outcome of this consensus building and the facilitation. So that's the final level of maturity that stakeholders agree. And again, you can use these outcomes for various purposes. As I said before, it helps you to understand what are your strengths, what are your building blocks, which work very well. Like for instance, in this case, again, I use the example from Puglia region. They identify commonly that they are really doing quite well when it comes to the breadth of ambition, citizen empowerment, process coordination. But on the other hand, the areas such as digital infrastructure or removal of inhibitors funding are really the areas where further work and improvement is needed. And also, I just would like to mention that you can see that there is a slightly different visualization of the outcomes here, because if you are using or if you are involving more than 5 stakeholders in the process, we are visualizing their inputs in the form of the bubbles. So the bigger the bubbles is, the more consensus on the particular dimension has been reached. So if you look at the process itself, there are 4 key steps. And as I said, you will hear from the presentations from the regions very concrete examples how this process has been implemented locally, what kind of added value and outcomes it brought for the regions, particularly looking today at the delivery of integrated care in remote and rural areas. I would like to emphasize that the process is very flexible. So regardless of what's kind of like healthcare system you're coming from, or organization, or the team you're coming from, the process can be adapted to really meet your requirements or your aspirations with this process. But we're always starting with the identification, who are the stakeholders who should be involved in this process, and that's really, again, vary depending on where you are coming from. But we try to emphasize that the more diverse the group is, the better discussions and the more interesting, I think, that whole facilitation and dialogue is. So it's always recommended to bring people from different sectors, from different profiles, and also positions in their organizations. We are not prescriptive when it comes to the number of stakeholders. We have conducted the assessment with the smaller groups between 5 to 10 people, but also with the much bigger groups over 30 and more. So it really does depend on what particular organization wants to achieve and see with this assessment process. Once we select the right group of stakeholders, as I said, we are interested to capture individually what each of these stakeholders thinks. So we are conducting online assessments individually. So everyone who has been invited in the process needs to fill in online questionnaire or online assessment to provide their inputs. And in the following 2 steps, we are then analyzing these individual outcomes, and then bringing them together for that purpose of building the consensus, negotiation, and reaching that final understanding on what is our level of maturity, but more importantly, what that level means for us in terms of the future actions and future ambitions. And I would like to just conclude with some, some highlights from the experience of regions using the tool. I mean, you will hear much more from the practical experience following this presentation, but really we see that more organizations and regions are using the tool. We see gradually that really the added value of the tool is that potential to facilitate and bring all different stakeholders together, make sure that there is a dialogue and mutual awareness raising and mutual understanding what each stakeholder does or plan to do, which is an absolute key when it comes to the delivery of integrated care, as we know that it's all about multi-stakeholder and cross-sectoral working. So I would like to finish my presentation by saying that this whole process is really very participatory process with an objective to facilitate the dialogue, facilitate discussion, but more importantly, help to orientate the users of the tool to the future actions and areas for improvement.
Thank you very much.
I think I'll stop here.
Thank you, that's excellent. And I will just ask John to share his screen and hand over to him. And while he does that, just to echo one point that Andrea has made about the different perspectives and perceptions that you can get a better understanding of. Certainly when you're sitting in a room with 10, 20, 30 people who have completed the tool, it's really fascinating to see the different perspectives, not just depending on where you sit within the organization or the team, but also on your awareness of what these different dimensions are and how we can all make assumptions that are sometimes wrong. So that's been very interesting to learn, and very interesting, more importantly, for the teams themselves. So without any further delay, I'll hand over to John.
Okay, thank you, Nessa, and good afternoon, everyone. I'm John Charamendieta. I work as project manager at Kronikune, which is the Institute for Health Services Research of the Basque Country. I will start my presentation introducing our region, the Basque Country, which is in the north of Spain, and it has a population of 2.17 million inhabitants. We have a high level of self-government. Our parliament and government have major legislative and executive power in education, health, policies, social services, and we have also fiscal autonomy and our own system of taxation, which is different from the other regions of Spain. Our investment in research and development is the highest in Spain and around the European average, and our system is financed by tasks. It's a beverage model funded with 3,305 million euros in 2018 and the same or less in 2019. And our social services are managed by local and provincial authorities. And in the last 10 years, we have been working on an integrated care approach that is based on three main pillars. Integrative governance to create synergies between different levels of care, population approach to coordinate the social and the public health actors, and culture and values to change from the culture of fragmentation to a culture of integration. And we have done this with an structural integration, creating integrated healthcare organizations to achieve less fragmented, more coordinated, more efficient and high quality of care, merging a hospital and primary care centers near to this hospital, under one organization with a defined population catchment area. We have now, since 2016-13, integrated healthcare organization with a workforce of more than 30,000 healthcare professionals. And also, we have been working on functional integration to coordinate the care process between primary and specialist care, designing clinical pathways mainly for high complexity patients or multimodal patients, managing polypharmacy, and coordinating the social and health services. And in the last 3-4 years, the Basque Health Department has deployed their strategy based on 6 priority lines that are people as core of the system and tackling health inequalities, disease prevention and promotion of health, aging, chronicity and dependence, system sustainability and modernization, professionals of the health system, and research and innovation. Along with this, the rest of the health system services has also developed their strategies, guidelines and plans to continue working to improve the healthcare system quality, equity, and care. You can see some example in the bottom. And we also have developed a series of tools that propose solutions to the priorities set out in the strategic documents. For example, we have an unified electronic health record, which is called OSAVIDE, that contains all health-related information on a patient, facilitates service delivery, and enables the provision of new forms of healthcare. That is now extended also to the nursing homes. We have an electronic prescription service called Presvide that has been integrated as a module within the electronic health record systems. We also have deployed a call center in which a group of qualified nurses provide services available to all citizens, series of telemonitoring services, new pathways, priority circuits, etc. And also a personal health folder to access to all the citizen health information. So they can access and get all their test results, GB reports, etc. And we have participated in different types of projects in different areas. And this has helped us a lot to develop this series of tools. They are focused on implementation, deployment of tools, policies, and pilots, among others. And some examples are the Sirocco and Sirocco Change project. In these ones, as Andrea has explained before, we have carried a self-assessment of the maturity of our integrated care approach. In our case, it's a 5-step approach because we have added the send of this summary of results and feedback of the process to be used as a tip for next steps for our department and authorities. So we identified a group of experts, of professionals. There were 8 healthcare experts and 1 citizen. Both from the Department of Health and Osakidetza, there were technicians, GPs, nurses, specialists, and the citizens is a patient that has been working with us for some time. All of them completed and self-assessment individually, and those are the examples, the outcomes. As you can see, there are big differences among them. And after that, we carried out a workshop to try to agree on the final scores for the Basque Country. We did it in the General Directorate of Osakidetza, the 18th of October of the last year. Osakidetza and Grenoble were moderating it, and we carried it out in Spanish. We had success on the process, and it took like 4-5 hours. And this is the final results. As you can see, we score 3 or 4 out of 5 in all the dimensions. The highest scores were in readiness to change, structure and governance, digital infrastructure, finance and funding, population approach, and breadth of ambition. And after that, we identified our main strengths to be able to help others and our weaknesses that we have to improve in the next years. Some of the challenges we identified are that we have to work in anticipation with a strong risk stratification approach. Now we have all our population stratified based on their morbidity risk, but we have to improve it. Longitudinal perspective care, creating individualized plans of care for mainly multimorbid patients, integrated care pathways, and continue working on citizen empowerment, and with a multidimensional action inside the healthcare system and with the social services. We have done this assessment twice, and as you can see, we have improved quite a lot in five of the dimensions. They are readiness to change, structure and governance, digital infrastructure, financial funding, and innovation management. And our idea is continue working on it in the next days with the consortium partners and try to improve a bit more this image. And to finish my presentation, I would like to send you some lessons learned, both from this assessment process and from our experience integrating the care in the Basque Country. And we have seen that our stakeholders have enjoyed the assessment process. They think it's useful for them and for the system, mainly for the process of negotiation, reaching consensus, and change management. And we think that all the stakeholders needs to be taken into account when defining new organizational models, that the new care pathways have to be integrated into day-to-day practice. It's key to use the population risk stratifications, and also the involvement of decision makers, because we have to facilitate the new procedures and encourage up taking new responsibilities. The learning takes time and resources, so it's important to try to facilitate them. And as you can see, as we can see at least, these kind of projects help a lot in the process. And this is all from my side.
Thank you, John. Very good. Excellent. And really interesting to see the difference, as you say, over time between the completion of the tool in 2017 and again. And also just thinking about it, the range of geographic territory covered in the Basque Country, not unfamiliar to us in Scotland, trying to provide integrated services across a population that has rurality as well as areas of quite high demand population. So I will just ask Andrea to get her slides ready, if she could start to share her screen, and we will hand over to you. But just to encourage people, I've mentioned in the chat, if people have comments or questions, please do type them into the chat and we'll pick them up once the speakers have all completed. Thank you. And I'll hand over to you, Andrea.
Yes, hello, I'm Andrea Rafaelic and I come from Slovenia. This is it was our first experience with the Scirocco tool, and we didn't use it on a national level, but we did it on the municipality level, because Slovenia is a small country with 2,000 million inhabitants, and with more than 300 municipalities. Yeah, and we chose. When we were choosing which municipality to work with, we chose one of the municipalities who have the worst conditions to develop community long-term care, integrated community long-term care. So Trbovlje is one of these municipalities, and even if it's in Slovene terms a city, it has lots of rural areas. Basically, it's a valley, an old valley, where they had lots of coal mines before, and then when they closed it down, lots of people were unemployed, and most of the people don't live actually in the valley, but live on the hills surrounding the valley. And but one of the most famous things about this village, or well, city, is that it's got the highest chimney in Europe, which they're very proud of. And they, even when we did the assessment, they quite often mentioned that. So there were basically two reasons why we chose this municipality, as I said, because it had these very hard conditions to develop integrated care. They have very poor community care and but also institutional services and so on. And on the other hand, it's also like the geography of the area. It's quite tough. Okay, so when we think of integrated care in Slovenia and also in the municipality of Trbovlje, we always think about it, the integration between social and healthcare services, and in particularly in development of the long-term care. So that therefore we focused on this area because it's also an important reform on the national level. So we supported with the Široko Exchange project, we tried to support that as well. And wherever you go in Slovenia, the existing services, health and social care services, are not integrated in one uniform system, and even health and social services are not themselves, the sectors are not really integrated, but each service provider basically lives and works in a bubble of its own. And also there is, in everyday practice, there's very little or in some places no coordination of services, which can make the accessibility of services very hard. And also even in areas where there is a lot of services, because they're not coordinated, it results in much worse results and yeah, lower quality of life. So and when how we did the maturity assessment in Trbovlje, basically it was, we try to involve all the stakeholders, social and healthcare stakeholders in the area. So when we prepared for the workshop, we organized it together with the municipality of Trbovlje. So we invited the health center in Trbovlje, which is the primary health sector, and then we invited the Center for Social Work, because each municipality in Slovenia has got a Center for Social Work. And then we invited, there's like a training center for adults and a nursing home, Association of People with Disabilities, Association of Seniors, which is quite strong in Slovenia, the youth center, and some sort of intergenerational NGO. And most of them participated in the consensus workshop, but two of them didn't, but they all responded. They all ticked the boxes in the Široko tool. So that the workshop was a really good experience, because basically what we found out is that all these services or representatives of the services, they've never actually, they are all the time by themselves talking about the need of integrating care, but they never actually ever sat down together in a room to discuss. So basically it wasn't not really that much important for us to have the scores, but what was the main achievement? It was to get everyone together and share their experience, and the Široko tool was just a tool to get there, yeah. So, and what the main point that came out in the meeting, what they said in the meeting, what was the last message of the meeting, was that they had the feeling that the local community is waiting for the national level to make some systematic moves, because it's a problem on the national level. But at the same time, they all thought, but maybe we have to start doing something and then make come from the bottom up. So our spider diagram looked like this. We scored much lower than the Basque Country if we compare for that. But what they felt really proud of, it was the implementation of telecare, because this municipality had an important project in that, and quite a lot of people from these rural hills participated in it. Then another thing was, which was quite important, was that with this Scirocco experience, they've decided that a social worker should be employed at the local hospital, where she could coordinate all different services. And then they also decided that they want to organize more of these meetings to sit together and decide what are the priorities in terms of development of integrated long-term care. So what are there's still the challenges in the local community? Definitely it's how to go one step further, not just to have now meetings, but how to develop coordinated joint actions in order to change the service provision in their municipality. The other issue is of the one of capacity building, yeah, because it was quite clear that they would need some sort of expertise consultation in order to develop better services, and of course in terms of evaluation of how the existing services are provided, but also how new innovation will function. Okay, so how these gaps that they had in the challenge, how they're gonna address them, they are thinking of creating a local action group who would be responsible to implement integrated innovations, and that the municipalities should be more in the coordinating role of all these innovations, and also the meetings. And the third thing is what they've realized is that they need to really assess the needs of the population first, to see what actually the people in the area need and what kind of services and so on. So what we learned from this experience, it's mainly that bottom-up solutions are probably quicker and also more better solutions who would really answer to tailor or be tailored to the people, not just to wait for the systematic change to happen, but maybe first test the new integrated solutions, then just wait for the national law to come out. Yeah, thank you very much.
Thank you, Andrea. That was excellent. And I'm just going to check the chat for any questions or any observations that we have as well. I think we have a couple of points to be made. So actually we had a question really, two questions from Andrea. So she has asked, how does rurality or remoteness influence the delivery of integrated care in your region and locality? So you've both kind of touched on that a little bit, but if we could think about that and expand on it. And then there's a follow-up questions. Were the conditions, i.e. remoteness and rurality, were they specifically considered as factors which would influence the outcomes of your assessments? So I will go to John first, please, if you could comment on that.
Yep. Okay. As I explained before, it has influenced a lot. We have deployed a lot of tools, mainly to access to people that can't join the health center or a hospital, and needs to be assisted by those kind of tools. Our main challenge has been the IT solutions and the legal procedures that we have been to tackle with. we have to tackle with, because there are a lot of problems when we share and we access to health information from our computer, mobile phone, or tablet. And for us, that has been key, and we think that we are covering it quite well, and we now can access to much more population through video calls with the GPs and so on.
Okay, thank you. And Andrea, you described really well also the geography and the rurality, but if you could comment on the question about, has this influenced the way the assessment has been done? Thank you.
Yeah, it's actually it was quite clear when we did the assessment that it influenced it a bit, because mostly the people participating in the assessment were thinking about, when they were like thinking about development of integrated care, were thinking mostly about the people who live in the valley and how to develop services and innovations for them, but they were not really considering that much the people living in the hills surrounding that, and that's mainly the older population who actually needs now more services. And there's the question of loneliness there, and also the question of how to reach these places, because sometimes in winter it's quite hard, and so on and on. So basically, we had to remind them about that as well.
Thank you. That's a very good point. And we have a question from Tino. Hi, Tino. Thank you. To all the presenters, did you identify the need of integration to be more about integration of the local health and social providers, or integration with specialists from the reference hospital, for example? And again, I will go to John first.
Yeah, in our case, we need both. It has been a bit easier to integrate a specialist from the reference hospital with the city centers, care centers, and the GPs. But yeah, we have to integrate also health and social providers. For us, it's a bit difficult because they are managed by different ministries, let's say, and so the funding is different, and we have to get on agreements, let's say. But yeah, it's both are key for us.
Thank you. Yeah, that's a really important point for us here as well in Scotland, isn't it? And I think you've both picked up that sometimes we talk about the integration of health and care when actually we still really struggle with integration of bits of health and bits of care with each other. Never mind integration of health and care overall. If we're honest, we do still struggle with these. And in Scotland, we have legislation to support some of the issues around funding and who pays for what. So that's always going to be a challenge. Andrea, do you want to come in on that one again, please?
Yeah, obviously our focus was more to integrate between health and social providers, because that's like a whole national reform and so on. And that's why we were discussing with the stakeholders more about that. But obviously, yeah, whenever we discuss about long-term care, we always talk about also this integration between the community services and the reference hospitals and so on. But yeah, at the moment, I think we're more focusing about these two, health and social sector. But it's quite clear that in this area where we did the assessment, the local hospital and the health center had very low collaboration between them.
Yeah, interesting. Thank you. We have another question from Sharon. Thank you, Sharon. What are the next steps looking at the outcomes of your assessments? Which dimension would you consider as crucial to address the challenge of remoteness and rurality? So in terms of that spider diagram and all those dimensions which your colleagues have answered questions on, which dimension would you consider as crucial to address in the challenge around remoteness and rurality? Andrea, this time we'll go to you first, please. Andrea, are you on mute?
Sorry, I apologize. Yeah, I totally forget. But yeah, so Well, what we want to do about regarding the dimensions, we want to develop further this dimension of innovation development, because we think it's quite important to start doing some work on it. So the idea is basically first and basically also the development of how commissioning pilot projects and involve SMEs and so on. So our idea was now for the further steps during the project also to take the some of the local stakeholders on study visits, where there will be a bit more where there's a bit more experience of innovating and piloting, but and also and at the same time to work something on the national level to more or less formalize the innovation management process and to enable pilot projects, because basically at the moment the way things stand, it's very hard to even start a pilot project in the existing legislation and so on.
Okay, thank you. That's helpful. And Jan, to you.
Well, in your case, we think it's key to reinforce the digital infrastructure and the population approach mainly. I think we have quite well covered those two areas, but and now we have as next steps. I think we have to work in citizen empowerment mainly to try to let's say teach people how to manage better their diseases and try to avoid unnecessary travels to emergency services and so on. So I think that our next steps will be focused on on try to make them empower them in general.
Thank you. And I think that, again, just reflecting a little bit on the Scottish experience, and the other Andrea can come in on this as well, but I think citizen empowerment is something that it's easy to say, it's not always easy to do, but it's crucial to many of those areas, to innovation, to how we develop digital infrastructure, and whether there's really a drive for change that's not just coming from the center. That's so important, isn't it? Just going to pause for a moment and check the chat, and if people wish to unmute themselves and ask a question, you can, of course, but if there's any other questions in the chat, I'm just checking. No, I don't see any others. Does anybody wish to unmute? I don't hear any voices. So the other point I had made, I had actually typed it into the chat so I wouldn't forget. That's why it's useful. Was, and I picked this up from both presentations, but I think in particular, Andrea, you drew this out in relation to the diverse group of stakeholders, and that was that the use of the tool itself, the tool becomes something to focus on, and the process of completing the tool and this project, it becomes something to focus on. And that helps to actually bring a group of people together and make a more cohesive group, perhaps. I don't want to put words in your mouth, but I've seen that certainly in some of the teams who've completed the tool here in Scotland, that opportunity to come together, they found that in itself useful. Would you think that's fair to say?
Yeah, I think it's actually it was quite it's our similar experience, and that's why we've decided also to use because we're doing two reforms in Slovenia now. One is in this long-term care, and the other one is in the institutionalization. So and we have altogether about 6 pilot projects in different areas. So that's why we've decided to start at the beginning of each of these projects, and that at the end we decided to use this Scirocco tool to basically as some sort of initial consultation, as well. So the stakeholders can at the beginning meet in these consensus workshops, meet each other and get to know each other, and then have it as a starting point of like a collaboration through the next 3 years.
Yeah, no, that's a really important point. And, that's the thing, we're taking a look at how your experience has been so far, but just as John, as you indicated with the use of the tool over time, things will change, and the participation of hopefully a diverse group of stakeholders will affect that change over time, and how we look at these different dimensions. It'll be interesting to see, obviously in both cases, where they go next. Just another quick point in the chat from Andrea. Have you experienced any particular difficulties in deploying digital services or digital tools themselves into these rural and remote areas? For example, thinking about broadband connections or any others, which seems to be a big barrier across Europe for these areas. And John, I think perhaps you mentioned digital infrastructure, so I'll go to you first on that.
Yeah, it's difficult for me to answer to this question because I'm not an expert, but I think that today, with the help of the family, I mean, even all types of kind of people, old people and so on, can access to easily, at least in the Basque Country, to digital services. Of course, they need to learn how to use them, but we are trying to. That's why we think that we have to empower them on the use of those tools. So maybe I'm not the best person to answer this question, but I think that it's feasible to deploy it, at least in the Basque Country and in Spain, as I know.
Thank you. And Andrea, do you want to come in?
Yeah, I mean, in this like the coverage regarding the broadband and so on was quite good in these areas, but even so, even when we did the assessment with the Scirocco tool, we struggled because lots of these organizations, they didn't know how to use the tool. So not lots of, but like 3 of them, we had to talk to them over the phone, and we were thinking, they were we were like, it was like an interview on the phone, and we were answering for them. So it wasn't about that much about non-access to the internet, but it was more about the skills and how to use it.
Yeah, thank you. And that's something we found, again, just flagging up the experience in Scotland. And something we haven't mentioned on this webinar really has been COVID-19. And obviously, all of the services we're trying to deliver are under particular challenges at the moment. And connectivity of citizens for us in Scotland has been is being addressed, but it's been flagged up repeatedly as an issue, significant issue in some areas, not just remote and rural. If you want people to be able to use services digitally, have they got access? Putting it at the most simple. I think that's it for the questions this afternoon. Oh, I beg your pardon, I spoke too fast. Andrea says it looks like you've built a really solid infrastructure to provide services to Jan. And also a point from Anne Hendry. Hi, Anne. How are you approaching intergenerational aspects of connectivity and digital inclusion? So I don't want to speak for you, Anne. Does that got intergenerational?
Yeah, absolutely, Nessa. I'm really interested in how maybe sort of age-friendly communities connecting with younger people who are more tech savvy.
Okay, I'm going to put that to Andrea, just because I know you flagged up the intergenerational element in your presentation as well.
Well, yeah. So actually, it's quite hard to answer this question, but because we haven't done much work on that. But yeah, it is. It's well, Slovenia being a country where there's like this merge of communist and Christian tradition, which both enhance solidarity and so on. But obviously things are, even though we still have quite a lot of solidarity, much more than the Western world probably. But even so, yeah, it was quite clear when doing this assessment that these people living up the hills are basically have like the younger generation left them there, and they were used to have this 2-generational house. They have usually big houses because it's quite a tradition in Slovenia to build in villages and so on, to build 2 or 3 generational houses and for people to live together. But now they have these big houses without the younger generation there. and without any support. So yeah, it's an important question, and how to use these places as well, yeah, because they could be used in these big homes in terms of like more community, as communes for older people or something like that, yeah. But basically, these villages were left by the younger generation.
And we see that in so many places, don't we, across Europe. John, did you want to come in on that, or?
I will try, but it's quite hard for me because I'm not an expert. I think that we should be doing something, at least, and again, talking about COVID-19, in the last months, most of the consultations have been carried out by phone, mainly by the call center that I have explained before, and as I can see, we have access to all the population, both youngs and olds, by phone mainly, and I think I suppose we are doing something, but I'm not an expert and I don't know too much about this.
That's okay. And I hope that's given some insight into answering your question. I think it's just a challenge every single one of us is trying to deal with.
Absolutely. Thanks so much, colleagues.
The final points for me, really just a couple of notes that I'd made listening to the speakers and thinking about some of the questions this afternoon, are just to say thank you very much to both our speakers and to Andrea for giving us the overview of Scirocco Exchange at the beginning, but particularly to Andrea and John for giving us their experience of how the tool is being used and what light it has shone on some of the integration progress in their countries. And also, I think really important, don't make assumptions, come across strongly to me. Don't make assumptions about what your citizens can and will do, and don't make assumptions about what your staff know and understand about the services that are being integrated, hopefully. And also value perspective. I think that's really important, valuing the perspective of the participants in the process and not just dismissing them for either not understanding or not having all the information. And perhaps thinking about what integration really means to different groups of people. And the final point, just on the last question which Anne raised about skills, people can't deliver the services that we want them to deliver, and people can't access the services we want them to access without the appropriate skills. So on that note, if that's okay with everybody, Andrea Pavlikova, did you want to come back in just as we finish?
No, I'm actually fine. I think you summarized it. You summarized this webinar very well, and just thank you so much to all of the participants and speakers. So thank you so much.
So keep an eye out for our next webinar on Twitter and on the website. You can see the Scirocco Exchange website, and the recording of today's webinar will be available soon as. So if you want any of your colleagues to take a look, and there are other webinars there about Scirocco Exchange, obviously you can take a look at as well, and we'd encourage you to do that. So thanks again to our speakers and to everybody who's joined us today. Cheerio.
Thank you. Bye-bye.
Thank you.